Doctors of Reddit, what are some of your anti-vax parent stories? I had a kid come in that was super sick. 3 years old and in septic shock. He had the flu and another compounded viral infection, or maybe pertussis. Heart rate was close to 200, respiratory rate in the 50s, blood pressure in the 70s. Kid was so fucking dry that we could barely get IVs into him and I almost had to drill an IO. We dumped a ton of fluids into him, started him on vasopressors and transferred him to the local children's hospital. I had asked the mom if he was vaccinated and she said, no, vaccines have really bad side effects. They'll make you sick. I explained to her that not getting the vaccines had made her kid 10 times sicker than he ever would have been from any mild vaccine reaction. She told me I was a fucking moron and that I obviously have no clue what I'm talking and that's the reason her kid was getting transferred. She also told me that recommending she vaccinate her kids was racist. Edit, didn't expect this to blow up, so some clarifications and answers to common questions. CPS was called and, once again, I was told there would be no investigation. This is their usual response. My wording about it possibly being pertussis was clearly confusing and misleading. I fucked up how I phrased it. Pertussis is indeed bacterial. Made the edit to make it more clear. RN an NP student, not an MD. This was like 2 years ago, I don't remember all the specifics. I didn't follow up with the other hospital about how the kid did. I try not to follow up on patients to keep things compartmentalized. I have the opposite of what you're expecting to hear, I assume. As a medical student, I went to see a young child, less than 1 year, in the outpatient clinic before the attending. The child was due for vaccines, and I talked to the parents about getting them on that day. The parents said they had reservations about them, so I talked to them about their reservations. We talked about all of the things they had read on the internet, and walked through each point one by one. One of the benefits of being the medical student is that you have nothing but time. I explained how vaccines are made and how they work. They don't have the mercury preservative they once did. Some vaccines are live but attenuated and others are immunogenic sequences bound to a protein, and why we get so many so early, that's when you're most likely to be affected by these diseases. They were concerned about the effects of so many vaccines at once. This is a common concern, but we challenge your system less with a vaccine than you see walking around in the world every day, and about them making the child sick, not possible with anything but a live vaccine, and that's why those are attenuated. There's such a small dose that a non-immunocompromised individual should have no problem with them, even though you might feel a little sick because we activate your immune system and that's how you feel when that happens. The whole discussion took probably half an hour. And then they decided to go forward with the vaccines. As it turns out, most people are just scared. And who can blame them? With all of the misinformation in the world, it's easy to see how parents get to that point. But they also are human, and when you sit and talk to them like the people that they are, intelligent and able to understand your points, they respond in a positive way. It's one of the moments in medical school that I reflect on frequently, especially when things are tough and I feel like being impatient with people. Edit, thanks for popping my gold cherry, y'all. So happy to hear about everyone who has had similar experiences with doctors taking the time to listen to their concerns and explain the responses to them. I hope everyone can work to reduce cynicism about this and other important problems. When I was a medical student, I had a 5-year-old patient who looked and acted like a 2-year-old, failure to thrive. His mother was super weird. She shaved the sides of his head, somehow like a marine cut, but kept his back hair long. She refused to vaccinate him or even feed him certain foods. Her sister and her husband were trying to get custody of the child because his mother was weird and didn't take care of him properly. I suspect she was paranoid. She would literally fight and call you names if you attempt to suggest to put the kid on a proper hospital diet. She wanted to inspect the food first and make sure he eats only certain things. Long story short, the attending calling county and they took the child away from her. Edit, thank you for those who pointed out that the haircut is called a mullet cut. Another point to add, he was admitted for a fracture which was really worrisome in a kid that age. Unfortunately, I don't know what happened to the kid after they took him away, but he's definitely better off. Friend of mine is a military OB/GYN. Was at a OB appointment with the pregnant dependent and service member. He had just returned from AFG a few months prior. Ob mentions about follow-ups after delivery in first year of life, including vaccines. Wife says, I read on the internet that vaccines cause autism, I don't think we're going to do that. Husband says, I saw a lot of little graves in Afghanistan, sure as shit we are getting our kid vaccinated. We had a 14-year-old female come in for abdominal pain one time. She weighed 80 pounds. Looked sickly. Her mother refused to let her eat anything but a handful of things, nothing with very much protein at all. She literally had a binder full of articles about how horrible vaccines are, all the bad things they put in food these days, etc. She had completely brainwashed this kid so the kid believed it too. Her labs showed malnutrition, her teeth were horrible. Just a sad case all around. I'll tell a different kind of story. I am an doc and recently had this interaction with a patient. Adult male comes in with fever, he comes back positive for the flu. Me, you have the flu, I will write you for a prescription for Tamiflu. Patient, doesn't that cause autism? This guy couldn't even remember that it was vaccines that reportedly cause autism, and he couldn't remember that it wasn't the flu vaccine, and of course he is wrong about vaccines causing autism, and he is a grown-ass adult that thinks he will suddenly be autistic. I was a medical student when this happened. My attending pediatrician gave me a heads up about the parent I was about to see and decided it would be best if he came into the room with me. 4-year-old kid came in with a horrible cough and difficulty breathing. It was almost sure as hell pertussis, aka whooping cough. The kid was coughing so bad he vomited on the exam table. He went on to ask about vaccinating her kid and of course she replied no, even though her son was damn near coughing up his lung right next to her. I think my attending had seen enough and had enough of her not vaccinating her kid and had the following conversation with the kid's mom. Attending, Mrs. I have to ask you. Do you trust me with as your son's doctor? Mom, of course I do, Dr. Gore. Attending, well, there's two problems here that we need to address. 1. You either think you are more knowledgeable than me when it comes to medicine, and if that's the case I should no longer be your son's doctor. Or you don't trust me as a physician and in that case I shouldn't be your son's doctor. Mom, blank stare on face. Attending, will you please reconsider giving your son a vaccine? Mom, no. My attending obviously treated her kid, but after this whole ordeal resolved he fired her and her son as a patient and referred them to another pediatrician. He had enough of her shit. I respected the hell out of him after he pulled this move. Edit, thanks for the hardware, kind stranger. I'd like to take the opportunity to educate people on vaccines. I thought the following links might be helpful. When I was a med student, I had a parent who wanted to do a delayed vaccination schedule. Basically it means that you get all the same vaccinations but you pointlessly and foolishly do it over a longer time period. The mom had read a book promoting this practice that was unfortunately written by an MD. My pediatric attending had zero chill. Is that the book written by Doc? Yes? Well, then you should know that I was in the same medical school class as Doctor, but I got much better scores than he did. I had a mother bring her child to see me as a new patient. When I saw that he wasn't vaccinated I asked my nurse why not, and she told me that the mother had a religious exemption. When I entered the room, I asked the mom what the religious exemption was and she said, oh, well, when he was a baby he had a rash from the hepatitis B vaccine. I kindly told her that I couldn't care for her child because he was not only a risk to my staff, myself, but also to other patients in my office. She went off on me and ranted about how she cannot believe that every doctor's office that she calls refuses to treat her son because he isn't vaccinated. And that the only doctor in the county that will see him can't see him for almost 2 months. I kindly stopped her and said, if I was one of a few that refused to treat your child, I would understand your frustration. But don't you think there's a message that not a single doctor in the entire county, save for one doctor who did some really questionable practices, think essential oils and stuff, will treat your kid? That maybe there's a valid reason behind it? Yeah, she definitely wasn't happy and left. Edit, wow, this blew up a lot faster than expected. I'm doing my best to get to some of the comments between patients at work. Love the interaction. Thank you all. Edit 2, I am thoroughly enjoying all these comments and interactions. Rip my inbox though. Edit 3, wow, thank you so much for gold. It's truly appreciated. Please consider donating to a nonprofit or help to sponsor an orphan for only about $1 per day. Thanks again, kind stranger. Med school student here. I was getting my hair cut and I was talking to the barber about how more people should get the new meningitis B vaccine, since I know a person who got meningitis B and almost died. The desk lady went off about how vaccines are dangerous, and pretty much every single anti-vax talking point. I explained the actual facts behind vaccines and said that I'm studying medicine, I think I might know what I'm talking about, and then she went off about professors not knowing what they are talking about and that they just teach what they are told to teach so that we can all be brainwashed into supporting the big pharmaceutical companies, and that my proof were all fabricated by them. Edit. Someone told me we made it into YouTube. Nearly qualified pharmacist here, so obligatory, not a doctor. Our pharmacy offers travel vaccines for people going away to countries with a high likelihood of severe tropical disease. Star parenting goes to the parents who got themselves vaccinated for rabies, but not their 2 primary school age elementary for non-Brits children.